Hello, come to the second part of functional independence measurement level. The second part of functional independence measurement level. In this, we will discuss about the components uh, on which this functional independence measurement level is based. These components consist of: first is self-care, second is spincher control, third is transfer, fourth is locomotion, fifth is communication, and sixth is social cognition. Now friends, we are going to discuss about the first part, uh, self-care. Self-care, it means, is the patient able to take his care by himself or not? It consists of eating, grooming, bathing, dressing upper limb, dressing lower limb, toileting. In self-care, we will see is the patient is able to eat by himself or not during the time of admission. In eating, we will see if the patient is able to eat by himself or not. Secondly, we will see if the patient is able to eat by himself but with the help of assistive devices. And thirdly, we will see if the patient is not able to eat by himself, he needs a help of a helper. In self-care, second thing comes grooming. In this, we will see if the patient is able to groom himself or not, his clothes or not. If the patient is able to groom himself with the help of any assistive device. And thirdly, if the patient is completely dependent on a helper for grooming. Thirdly, in self-care, it consists of bathing. We will see the patient is able to take a bath by himself, or the patient needs the help of any assistive device, or the patient is completely dependent on his helper or assistant for bathing. D is dressing upper limb. In dressing upper limb, we will see if the patient is able to completely or independently able to dress himself or not, or he needs a help of any assistive devices for dressing his upper limb, or the patient is completely dependent on his attendant or helper for dressing the upper limb. E is dressing lower limb. In this, we will see if the patient is independent or able to dress his lower limb or not, or he needs the help of any assistive devices for dressing his lower limb, or the patient is completely dependent on his attendant or helper for dressing his lower limb. And the last part is toileting. Okay, now we come to the second point, spincher control. In spincher control, we look for 2 points: bladder and bowel. Bladder is related to urination, and bowel is related to passing of a stool. In this, we will see if the patient is able to pass his urine by himself, or he needs the help of any assistive device, or he is completely dependent on someone who on a helper or a attendant who helps him during the process of urination. In bowel, we will see that the patient, if the patient is independent in passing his stool or fecal matter, or the patient is dependent on some little bit dependent on someone else in passing the process of passing of stool, or the patient is completely dependent on someone else, his helper or attendant, during the process of passing of stool. Transfer. That in transfer, third point, transfer consists of bed, chair, wheelchair. In this, we will see if the patient is able to transfer himself independently from bed to chair, from bed to wheelchair, from wheelchair to chair, or wheelchair to bed, or the patient is little bit dependent on someone for transferring him from bed to chair, or bed to wheelchair, or from wheelchair to chair or bed, or the patient is completely dependent on someone in the process of transfer from bed to chair, bed to wheelchair, or wheelchair to chair or bed. In transfer, second point comes toilet. In this, we will see if the patient is able to go from his room or bed to the toilet room completely by himself, or he needs a little bit help of any attendant or helper during this process, or he is completely dependent on some helper or attendant during the process of going from a room to the toilet. He is completely dependent. And the last point in transfer is shower and tub. In this, we will see if the patient is completely independent while taking a shower, or a patient is a little bit dependent on anyone, helper or attendant, a little bit dependent on them while taking a shower, or the patient is completely dependent on someone for a shower. Fourth point in functional independent measurement level comes locomotion. Locomotion is related to movement. In this, we will see if the patient is completely independent, he can move from one place to another, he can walk from one place to another, or he can move from one place to another with the help of wheelchair completely independently by himself, or he needs an attendant or helper, someone to initiate, someone to help him a little bit during the process of walking, or during the process of locomotion with the help of wheelchair, or the patient is completely dependent on his attendant or helper in the process, during the process of locomotion through wheelchair. In locomotion, second point comes stair. Stair consists of 2 points. Climbing the stairs means ascending the stairs, and going down through the stairs means descending the stairs. In this, we will see that if the patient is completely independent in climbing the stairs or getting down from the stairs, or he needs a little bit of help of some attendant or helper during the process of climbing the stairs or going down from the stairs, or he is completely dependent on some attendant or helper during the process of stair climbing or going down from the stairs. Communication. In communication, first part is comprehension. In this, we will see if the patient can explain himself properly to his attendant or helper, or he is little bit dependent on someone or completely dependent. And the second point comes expression. Sixth point is social cognition, which consists of social interaction, means interacting with the family members, the doctors, and second point comes problem solving. In this, we will see that if the patient is able to solve this problem by himself or not. And third part is memory. If the patient can remember his name, place of birth, age, mother, father, wife, etc.